Well, thank you very much, folks, for being with us tonight. And Bruce has touched a little bit of the tip of the iceberg in telling you some of the overall benefits of glutathione. And as you know, each week we take a more in-depth look at specifically what are the benefits with regards to glutathione. And tonight we are going to see what the benefits are for the kidneys. You're going to be quite surprised when you hear about the statistics on kidney disease. And we'll start out by showing a PowerPoint. Now, most of us know or have a general idea as to why the kidneys are beneficial. They filter the blood, they dispose of waste products, primarily through the urine. But very quickly, if there's any complication with the kidneys, the toxins and the other waste products will start to accumulate, and the other organs are affected quite rapidly. So it's really very important that the kidneys be functioning properly. One of the big things that occur is cysts begin to grow on kidneys, and this is called polycystic kidney disease, and this interrupts the function of the kidney. So when it comes to the disease of kidneys, it's a sad situation that we want to really focus on tonight. The primary cause, the main two things that cause pretty much all kidney failures, or what we call end-stage kidney disease, ESRD, is diabetes, which we spent a lot of time on several weeks ago, primarily type 2, or otherwise known as adult onset diabetes, and high blood pressure. Those two things alone contribute to most of the degenerative problems of kidneys. Some other things are heart and blood vessel disease, and of course smoking contributes to that, obesity contributes to that. There is some genetic propensity for kidney disease in African Americans, Native Americans, and Asian Americans. And it also appears that kidney disease can be inherited. There can be a family history. And then there could be just an abnormal kidney structure. How do you know if you're getting kidney disease? Well, much of it depends on the urination aspect. If you see foamy, bloody, discolored, or brown urine, it's painful. If there's swelling in your arms and wrists and legs and ankles, or around your eyes, your face, your abdomen, that could indicate kidney disease. Restless leg syndrome, and when it occurs particularly during sleep, could be indicative. Joint or bone pain could be indicative. And then because the kidneys are located in the middle of your back, if you start feeling pain there, that could be symptomatic. And finally, if you're just tired all the time, that could be another complication. Now, statistics are not good. There's 37 million people in the United States. That's about 15% of the adult population, about 1 out of every 7 adults. But 1 out of every 3, which is almost 80 million people, are at risk for chronic kidney disease. There's hundreds of thousands of Americans that have kidney failure. There's almost 500,000 individuals on dialysis, and roughly almost 200,000 live with a functioning kidney transplant. Now here's more bad news. 10% of the population worldwide is affected by CKD, and millions of people are dying each year because they can't get access to affordable treatment. That means that about 850 million people worldwide have some form of kidney disease, and that's about twice the amount of people that live with diabetes. So this is a substantial health problem. Cost, well, just the fee-for-service Medicare patients had $50 billion in expenses for end-stage renal disease, and then another $30 billion for the ESRD patient population. Now, the conventional medicines that are used are considerable. There's blood pressure tablets, otherwise known as anti-hypertensive tablets to lower blood pressure. There's diuretics, which help get liquids out of the body. EPO is another drug that's used because the kidney patients have problems with their blood, and this EPO, or erythropoietin, is used to help generate new blood platelets and red blood cells. And by the way, when these new blood cells are generated, they actually have a better chance at producing glutathione. So it's another reason why EPO has proven to be a good benefit. Hepatitis B vaccinations, iron supplements, phosphate binders, sodium bicarbonate, and statins. Now, there's sufficient medication. It's not resolving the issue. So the question is, why do we want to increase glutathione? Well, one of the big issues with kidney disease is that it increases oxidative stress levels. Now, the difference between your oxidative mechanism and your antioxidant mechanism is called your OS level. So the difference is oxidative stress. And you have substantially higher oxidative stress level when you have kidney disease. And glutathione is the most powerful antioxidant that's been discovered in the body. So, number one, it can ameliorate, it can help bring down the oxidative stress levels that are caused by the kidney disease itself. But also, it can bring it down in the oxidative stress caused by dialysis. And these findings are being more and more verified as more research is done. I've got a few studies here I wanted to show you. The first one, this was published in 2014, just 6 years ago. N-acetylcysteine is actually a precursor for glutathione. Now, the medical arena has used N-acetylcysteine. It's a drug which is a synthetic form of cysteine, and cysteine is the rate-limiting factor for the body to produce glutathione. So it's easier for them to do clinical trials if they can get this form of cysteine, which can be either orally taken or it could be in a IV drip intravenously. Now here this one was used for this study, and the title of the study was N-acetylcysteine is associated to renal function improvement in patients with nephropathic cystinosis. Now, it goes into the abstract, and again, these are very long studies, multi-pages, but the abstract shows that nephropathic cystinosis is an autosomal recessive systemic severe disease characterized by intralysosomal cystine storage. Now, the conclusion of this study, they did a 3-month study with 23 patients using NAC, and the oxidative stress was reduced and renal function significantly improved. Now that's a study right there that shows that just by raising glutathione. Now you notice it doesn't really highlight that there, but up here it says that there's solid evidence that cysteine accumulation itself is not responsible for all abnormalities in cystinosis. There is also a deficiency of glutathione. So put 2 and 2 together. They used N-acetylcysteine over 600 milligrams a day, and significantly the renal function was improved, and no side effects were detected. Now, The downside, of course, to N-acetylcysteine is that it's really not something you want to use on a daily basis forever. So our recommendation on a better form of glutathione production is going to be toward the end of this presentation. Now here's another one. This was published in 2011. The protective effect of N-acetylcysteine on early outcomes of deceased renal transplantation. Now, that doesn't mean they tested it in dead people, but they investigated the effects of antioxidant NAC on early outcomes of deceased donor renal transplantation. So they had a group of people that received transplants, and this is interesting because we have tended to tell people that have gotten transplants that you need to be cautious with glutathione, with raising glutathione, because sometimes and this is especially true when they're on immunosuppressant drugs, if you raise the immune system too high, your body rejects the organ. But you notice that the result here of this abstract, it says our results suggested that N-acetylcysteine enhanced early outcomes of deceased donor renal transplantation by attenuating oxidative stress. That is quite impressive when you consider that even someone that gets a transplant, they need glutathione. And so by elevating glutathione, even in someone who received the transplant, you help lower the oxidative stress that was caused by the actual transplant itself. In fact, we can go a little step further. Anytime you have any kind of surgery, you're going to have a total body reduction in glutathione. So whether you have an elective surgery or the surgery was done because of an emergency, very important that you very rapidly start to take precursors to get your glutathione levels up, because the body's going to steal glutathione from the liver and sometimes even the kidneys to move it into locations in the body where you've had that surgical trauma. And that's what it is. It's trauma. Here's another one. This is interesting. It followed the pathways of glutathione transferase. Now, the glutathione S transferase A1, M1, P1, and T1, null or low activity genotypes, are associated with enhanced oxidative damage among hemodialysis patients. So now we're talking about patients that are on dialysis, and if they have low levels of this glutathione S transferase with these 4 different pathways, they have more and more oxidative damage. So in the abstract it says increased oxidative stress is a hallmark. In other words, it's an absolute. You're going to see it at end-stage renal disease, ESRD. And the results of this study, and again I shortened the study to show this, the level of oxidative and carbonyl stress was most pronounced in the subgroup of patients with all 4 null or low activity of the M1, the T1, the P1, and the A1 genotype. So what's the conclusion? According to the genotype, the end-stage renal disease patients may be stratified or grouped in terms of level of oxidative and carbonyl stress that might influence cardiovascular prognosis, but could also improve efforts toward individualization of antioxidant treatment. Now, I love the way these studies throw in these polysyllabic words so that you can't understand half of what they say, but I'll cut right to the chase. End-stage renal disease has got this high oxidative stress level. It's also in the pathways of the transferase, and if you raise glutathione, it's going to be helpful. It's going to lower this oxidative stress. The oxidative stress here in this particular incident contributes to cardiovascular disease. All right? So, let's get a case example of someone who had an aged grandmother. This grandmother had serious complications that were brought on by diabetes and really went into late stage kidney disease. So we'd like to listen to this experience given by Mariluz Torres, and I'm going to stop this for a moment. Mariluz, are you with us today?
I am here. How are you, Jim?
Good, Mariluz. Why don't you go ahead and tell us the story about your grandmother and what happened?
Well, my grandmother and my family in general, they come from a long line of diabetics. Pretty much there were 10 brothers and sisters. There's only 2 left, including her. And every single one of them has died of complications of diabetes. She has the youngest brother who's still alive, and he is a dialysis. So, you know, it's a pretty serious thing within the family. So about, I would have to say, for 15 years, you know, I think close to 20 years ago, she started showing signs that, you know, that she was having diabetes. And it's interesting because of all the brothers and sisters, she's the one that was really conscious about her health, about nutrition. So she always took care of herself. You know, her brothers and sisters had diabetes early on, and she didn't get it till probably in her 70s. So of course, you know, it started to become a problem. And you know, she lived in Puerto Rico. We were here in the United States. So, you know, we tried as much as we can with a caretaker to take care of, you know, her, the way she ate. But, you know, there's age, there's the fact that it's hereditary, and, you know, a bunch of other stuff. So anyways, after Hurricane Maria, of course, it was terrible. They were elderly, so we brought them to the United States to, you know, to live with my parents. And of course, we were already taking Immunical, and my mother said, you know, we have to take this very seriously because, you know, we know what has happened to the family members before. So one of the things that surprised my mother, of course, is that, you know, when she took her to the doctor to get her checked up, her kidneys were not working well. And the doctor was very, very concerned because he said that her kidneys were working at 25%. And of course, it was due to her not taking care of her diabetes. You know, and I remember even before when we would go visit to Puerto Rico, and sometimes we noticed that she had her sugar in 200 and 300. So we know that was just a little bit too much. So anyways, so we started her on Immunical, and immediately we started seeing that the sugar numbers going down. The sugar levels would be going down. And my mom would be really happy because, you know, she would wake up with 110, 120, which was a lot lower than what she had before when she had just moved to the United States. So, of course, you know, my mom was taking care of her diet and everything. So I would say, Jim, like around 6 months to 9, I'm not sure how long it was, but about 6 months or 9 months that she had started taking Immunical. My mom took her to the doctor again to check her kidneys, which was the main worry that we had. And we were surprised to hear that her kidneys had improved, that they were working at 30%. From a 25 to a 30, we thought we were happy because that's progress, period. You know, the doctor was very, very concerned that she would end up in dialysis, and now we see a little bit of improvement. And the sugar levels keep going down, keep going down, keep going down. It's been a few years after Hurricane Maria, and it's amazing because for the past year, my mom was so impressed because every time she checks her blood, you know, her sugar in her blood in the morning, you know, we're talking 90. We're talking a bad day because she ate cake the day before, you know, 100. Sometimes 85, 92. I mean, those numbers are amazing to the point that every time she goes to her doctor, one of the last times the doctor says, you know, when they do those special checkups, what do you call it, the A1C? Yes, they're completely normal. They're completely normal. It shows no diabetes. Like, she has never had diabetes before. We're talking about an 88-year-old grandma, 15 years diabetic, and that her A1C is better than my mom's that just turned 70. she shows no sign of diabetes. But this was the major surprise. This is 2 years taking Immunocal. And not even a month ago, I shared with my team that my mom went to check her kidneys once again. That is really our biggest concern. And my mom just says that it was amazing. The doctor was so happy. The nurses were so happy because they were like, we just can't believe it. When her labs came back, there was no potassium, there's no protein. Her lab work was indicating a completely normal function of a kidney. Of an 88-year-old grandma who's supposed to get worse and not better. Of course, the sugar, we're happy, but we're also taking care of her diet. There's many things we're taking care of besides Immunocal. But to see the functioning of her kidneys completely normal. My mom just called me. She was crying. She was so excited. My grandmother was so happy, because even in her age, she's like, we call her Mariluz. She's like, we've got Mariluz for a few more years, She was so happy. But once again, it's, I started taking Immunocal because of my health, and then my parents, and then my kids, and my husband. And now to see my 88-year-old grandma getting better instead of worse, it's just pretty amazing. But it makes us fall in love with Immunocal once again. This is something that we definitely need to continue sharing. And it doesn't matter how old our grandparents are, to see my grandparents having quality of life, even though they have their issues, but, to see them happy, healthy, with a quality of life is priceless. So that's pretty much my testimonial for today.
Well, Mariluz, thank you so much for sharing that with us. And, when we look at the picture of your son with his, I guess that would be his great-grandma, right?
His great-grandma.